If you have chronic hair loss problem, then by now you must have understood that this kind of male pattern baldness or a female pattern hair loss is generally because of the hormonal issue, and the hormone here responsible is testosterone. So now suddenly why finasteride has gained all the importance in such treatment modality? Hi, my name is Dr. Nandini Dadu, and today I'll tell you why is finasteride important and how will it help in your case. Testosterone is a hormone which is naturally produced in your body, both in men and female. Definitely it is more in men because it is a male hormone and less in females. But ultimately this testosterone gets converted into dihydroxytestosterone, that is DHT, with the help of 5-alpha reductase type 2 enzyme. So now what happens is that when the DHT is produced, it has a special binding receptor on the hair follicle. So now this DHT goes and binds to the receptor and makes your hair a little weak. It does the miniaturization of the hair, it makes it thin, and ultimately leads to hair loss and hair fall. Now the importance of this information is, now you have to understand that the role of finasteride comes into play here. Finasteride, which is generally termed as a DHT blocker, you must have googled it, you must have understood, you must have read about it, but now how it helps in this kind of hair loss problem is to understand here. Finasteride basically stops the conversion of testosterone to DHT, that is dihydroxytestosterone. Therefore, the less amount of DHT that is available to go and bind with the receptor available on the hair follicle, leading to less hair loss, hair thinning, and less hair fall problems. Finasteride, which is very commonly now available in market, is in oral form and in topical form. When we talk about the oral form, we have in concentration like 1 mg, 5 mg, but which one is important for men and which one is important for female, that can only be advised by the doctor or your treating physician. So when we talk about the oral form of finasteride, generally we give around like 1 mg per day to men, and it can also be taken on the alternate days. When we talk about females, it can be gone up to like 5 mg per day or maybe on alternate days, but then you have to understand that it has to be strictly taken under the supervision of a doctor, because we have to understand the dosage and also that you do not get any side effect of the finasteride that are less minimally seen and visible in the population that is taking finasteride. When we talk about the side effects in finasteride, they can be loss of libido, you can have erectile dysfunction, which can have sexual dysfunction, which can have breast tenderness, and that is why it is advised that you discuss your case with your doctor and take oral form of finasteride accordingly. Finasteride is also available in topical formulations. Topical formulations means in the form of hair serums and gels. When we talk about the hair serum, you will generally see it coming in combination with minoxidil with a concentration of 0.25 to 0.5% to be applied on the scalp every day, and for better growth and for reducing the hair fall and to see more growth of your hair follicle which are in the miniaturization stage. So now we talk about the topical formulation. You have to understand that it is also beneficial because it has lesser side effects than the oral form of finasteride, but then it has to be given according to the kind of hair fall, hair loss problems that you have. Is it right for your kind of case? And then that is why it is decided by the doctor that if you are a suitable candidate for the oral formulation or for the topical formulation. So the information given in this video is basically important for you to consider few things about finasteride. That is, this is not something that you take over the counter. You can't simply go to the chemist, purchase the medicine and start having it without even being aware of the dosage and the side effects. Then the second thing is that you go to the doctor, tell your problem to the doctor, let him analyze your scalp, see the pattern of your hair fall, hair loss, and then decide if you are a candidate for an oral finasteride or a topical finasteride, and also if you have had any history of finasteride consumption in the past or any side effects that you faced with it. For more such informative videos, you can subscribe to our YouTube channel DMC Trichology and also follow us on Instagram. Thank you.